Nathan Hill here, host of Success Stories. Joining me today is Lindsay Dial of Always Caring Homecare. She is the executive director of Southwestern Idaho. And we are here to talk about the effect of parents performing PCS caregiving, parents and spouses performing PCS care for their loved ones under the coronavirus pandemic waivers. And this is done through the 1135 waivers. Lindsay, welcome.
Thank you. Thank you for having me.
And so, Lindsay, tell us as we get started here a little bit about Always Caring Home Care.
Always Caring Home Care provides personal care services and private duty nursing services to our vulnerable population here in southern and eastern Idaho, also northern Idaho. And we have been in business for, this company since 2015. And yeah.
Okay. And about how many families do you serve?
Under the pandemic?
Just altogether.
Altogether, we serviced over 300 participants.
Okay. And so tell us what you know about, my understanding of these waivers is that essentially as the pandemic set in and, government agencies were tasked with how can we make healthcare more accessible and easier through the pandemic. Every agency was tasked with, what can you do? CMS, which is Centers for Medicaid and Medicare Services, and Health and Human Services said, you know what? We can allow parents and spouses of special needs loved ones to perform PCS caregiving for their loved ones. Okay, we can allow them to do that. Is that understanding correct?
Yes, that is correct.
Okay. So this is done through the 1135 waivers that each state applies for under the public health emergency. It's a waiver that it's a waiver of the Social Security law that says that parents and spouses cannot perform personal care services. It basically prohibits legally responsible individuals from those who are legally responsible for the special needs individual from performing those personal care services. So under the pandemic, parents and spouses have been doing this through the nursing agencies. Over the last 2.5 years, how many families have you had performing this, this PCS care?
We have about 50 that are receiving their parent or their spouse.
Now, pardon me, the connection here was choppy. You said how many?
We currently have over 50 participants receiving services from either their parent or their spouse.
Wow, so over 50.
Yep.
Wow, okay, so you have a lot. Now, you are one agency in southwestern Idaho, okay? Of the many agencies there are, you are one agency.
Yep.
And you have over 50. Okay. If the public health emergency ended right now and parents and spouses could no longer do this, would you be able to staff those cases right now?
We would not. We do not have enough caregivers. Hiring right now is very, very difficult, and it's gotten worse since the pandemic.
Okay. Was the hiring climate difficult before the pandemic?
Hiring in this industry has always been difficult, but since the pandemic, it's gotten even worse. Right now, we are competing against other businesses that are paying significantly more than what we can offer due to our low reimbursement rate. And so when we're competing against McDonald's that's paying $15 to $16 an hour, we're not getting the amount of caregivers that we need.
Okay. And so basically, there was a shortage before. It's worse now because we're talking, this is a job that, I mean, you're feeding, you're toileting, you're bathing, you're doing laundry, you're doing housework, you're changing diapers, everything. Okay. And it's heavy work too. Okay. I mean, this you have to be careful, how you deal with these patients, because it's heavy work. Okay. And you're saying that you have to pay them less than they can start a McDonald's for.
Correct.
Okay. And as far as these hiring parents and spouses, are they any less qualified? Are they just like a shoe-in, or do they have to complete the same training as all of your other PCS caregivers that you would hire?
Yeah, even if, I mean, obviously these parents have been taking care of their kids, from day one. However, we are still required to follow state rules, and they still have to complete these state required training, um, getting background checked, which all costs money.
Okay. So they're doing their background checks. They're having to go through all of the personal caregiver training. Okay.
Mhm.
They have to do all of their annual compliance. Is that right?
Correct.
Okay. So they have to go through all the annual compliance. So they don't do anything different when it comes from a training standpoint.
Nothing different from any other caregiver.
All have to clock all of their shifts in the point of care app, in the electronic verification visit app. Okay, because that's federal mandate. So
Yep.
all their shifts are clocked, and their location is tracked in the app. Have to fill out all the progress notes just like any other caregiver. So there's no difference. So they've been trained by you. They have to keep their annual compliance up. They have to clock everything just like a caregiver. It has to be signed off. Are they supervised by the supervising RN as well?
Yes, they are. So if this participant has a task that requires a return demonstration, like a G-tube feed, our nurse still provides that training, whether it's the parent or not.
Okay. Okay. So they are complete. Their training is the same. They're supervised the same way. Everything's
Mhm.
clocked and reported the same way as any other PCS caregiver. Okay. Have you, since this started, okay, where parents and spouses could be paid, have you noticed any any difference in the quality of the care that is delivered to the patients?
You know, the part about that is that, our clients know these individuals. They trust them. When we don't have a caregiver available, they are the backup plan. And so I do believe that has provided this better quality of care be- because level as well.
Okay. Have you seen a difference in the tension or the stress level of the home? And what I mean by this is that you're very familiar with these homes, okay?
Mhm.
And that in these homes, when there's not a caregiver, spouses or parents are filling in. It means we're pulled away from our professions, right? Okay. And being pulled away is a constant thing. Okay. And in a lot of these cases, being pulled away is a constant thing. Some people get sick or take new jobs, decide this isn't the career I want, etc. Okay. Move away. And these situations are 24/7. Okay.
Yep.
And so when you don't have a caregiver at night, you're up in the night. Yeah, you're filling in between shifts and the whole bit. So when parents and spouses are getting paid, have you seen the stress level or the tension in the home decrease?
I have. And with that, these participants, specifically these kids, if we don't have a caregiver, that does pull the parents away, which takes them away from their job. majority of the time, these parents are having to quit their jobs. And because you cannot take these kids to a regular daycare, they cannot go to a daycare. It increases risks of illness. It increases, all the risks. I mean, you can't take a child that has a trach to a daycare. They cannot provide the care that
Right.
child needs. And then it's forcing the parents to quit their jobs, and now they are having to take money, take the assistance from the government. So being able to provide them this income and taking the best care of their loved one is the best outcome.
So, wow, you bring up a really important point. Okay, so a lot of these households, one of the parents is having to quit their job, okay, which means that when they quit their job, they are now having to get on the welfare system for things like food stamps, healthcare insurance, all of that stuff. Okay. So they're taxing the welfare system more. And when you pay them what you would be paying a personal care service, a personal caregiver anyway, because you're going to be paying a PCS caregiver anyway. Okay. So when you pay them, you have continuity of care. Okay.
Yep.
So because as parents and spouses, we don't quit, right?
Yep.
We're here. Okay. We don't get to quit. All right. So we're here. So when you pay one of them, so instead of them having to just quit their job and get on the welfare system, now you're reimbursing them and you're not paying them anything more than what you would already be paying, because you would be paying a PCS caregiver. And in doing
Yep.
so, in paying the parent or the spouse, you are reducing the amount of welfare dollars that's being paid out to welfare recipients, because they are not having to, say, take food stamps or take Medicaid health insurance, because they can get they can afford the health insurance through the other spouse's provider. Or I mean, I know some nursing agencies even provide
Mm-hmm.
healthcare insurance and benefits. And so we tax the system less by being paid. That's a very important point.
Yeah.
Okay. So if this public health emergency ends and this provision goes away, what will happen to these 50 some odd homes that you have?
If this goes away, we have over 50 clients that will be without a caregiver, a paid caregiver anyway. And these families are going to lose the income that they've been receiving because of the waiver.
And so we're going to shell out more welfare expenditures for them. We're going to be we'll be receiving less federal and state income taxes revenue, because I mean, they're an employee of the nursing agency, right? So they're they have to, they get withholdings taken out of their paychecks. It's worse all the way around. Okay. And do you see then the tension is going to rise in the homes? When tension rises, that's where you begin to, I would presume that maybe even you've seen this in your years in the healthcare industry, that, as the tension rises in the home, then you see things like, marriages fail, things like that. So those are all things that when marriages fail, your welfare costs just go up exponentially.
Yeah.
So this is a program that is really doing a lot of good. Okay. What kind of feedback do you have from the parents and spouses that are performing this?
We get thanked very often from our parents and spouses for allowing this. It does help financially for them, but it also is consistency. The spouses and the parents are always there. So this person is always having a paid caregiver in the home. And you do see a significant difference in um, the health of the client, which is why we do what we do. That's the most important part. And the consistency, people do get sick, but as family members, you're always there.
Right. So the feedback you're getting is you have spouses and parents saying, thank you so much for letting us do this.
Yes.
And you're seeing the consistency in the care being better, and
Yep.
and the patients that are being served by the spouses or parents are healthier.
Yes.
Okay. And which certainly we could vouch for that on this end of the spectrum. Now, Lindsay, that I have been talking to Medicaid about this for about 13 years, telling them you should be paying parents and spouses to do this. This is ridiculous. And their concern to me is that they've always voiced to me is, well, this opens up the door for fraud and abuse. In the 2.5 years that this has been going on, let's take each one of these things one at a time here. Have you seen abuse to any of the patients be a trend?
I have no reported cases of any abuse on the family serving family.
Okay. Have you seen any fraud be a trend?
I have no reported cases of fraud either.
Okay. All right. Probably, I would venture maybe that one of the problems that you run into actually is the reverse, that sometimes parents or spouses, because we're so used to doing this, that maybe we forget to clock in actually. Because we're so used to doing this. And so you start to do like, oh yeah, I forgot to clock in. Okay.
Yeah.
All right. So if there was one thing that you could tell CMS, Centers for Medicaid and Medicare Services, or Health and Human Services about this, what would you say?
I would say that I really hope that they consider making this a permanent change. It has made it a lot easier to bring caregivers on to provide the care to these clients. And these are our most vulnerable participants. And it has made family life a lot easier because they're not as worried about an extra income. And we know that these participants are getting the best care because regardless of us having a caregiver or not, they are there to provide that care. And again, they're not having to live off of the welfare system.
Right. So make this permanent. Boy, if we could echo that, okay, so we're saving the welfare system money. We're actually adding to the income tax revenue because, one spouse generally has to quit a job, less income tax revenue, more welfare costs to the government. Okay. So, boy, make this permanent. So, CMS, Health and Human Services, when and as you watch this, okay, with the pandemic, making this waiver went just like that. It was like, you know what? We can do this. We can let parents and spouses take care of their loved ones to circumvent these vulnerable individuals from getting the coronavirus and to make care available to them that will not be available to them during the pandemic. Okay. And as we know, post-pandemic, the climate is harder. So, boy, if Health and Human Services and Centers for Medicaid and Medicare Services, if you could make that temporary waiver like that, let's just put an interim rule in place like this that says, hey, we're going to let parents and spouses continue to do this because it is saving us money in medical costs because the patients are healthier. It is saving us money in welfare costs because the families are using less welfare dollars. And it's increasing the tax revenue that we're bringing in. Win, 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 win. Let's make an interim rule like that. And let's make this happen.
Yep.
So, all right. Well, Lindsay, thank you so much for joining me today. I really, really super appreciate it. And
Thank
spread the
you.
word along. I would be interested to talk to some of the other families and get the family perspective as I continue to reach out to nursing agencies around the country. If you're watching this and you have a story to tell, please just direct message me and I'll get in contact with you and we'll get you on here. So thank you so much, Lindsay. I very much appreciate it. You have a wonderful day. You're welcome.
You too.